everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today, and we have a special guest today. It's Kat McDavitt. She's founder, principal advisor, and head of public affairs at Innsena Communications, and she's also the founding donor of the Mothers in Medicine Fund, which, I mean, just to be clear, the Mothers in Medicine Fund is a collaboration with the Sharp Index, which I think a lot of people, if you've ever dealt with burnout, you've probably seen Sharp Index, which is a nonprofit dedicated to that idea of physician burnout. And so we're going to learn more about it now. Welcome, Kat.
Thank you, John. Thank you for having me. So excited to talk to you about this.
Yeah, so I mean, I think you have such an incredible story, but tell us a little bit about yourself and how Mothers in Medicine came to be.
Yeah, so I'm a lifelong health IT communications person, right? I've been in this industry since high tech, so a long time, and worked with over 70 companies in the space, primarily working with clinicians, right? And a lot of them say, we're helping reduce burnout, right? We're simplifying the way healthcare is run. And I think a lot of that can be true, but I also think sometimes the impact is not direct at all, and sometimes it's not true. So I've been a consultant for a very long time, most of that time period actually at various agencies. And then I started Innsena Communications about 4 years ago, fell in love with a client, Collective Medical, and sold the agency to Leslie Kirk, who I think we both know and love, especially when she goes on her Twitter benders like yesterday.
She's the best.
Yeah, right. But joined Collective Medical as the chief marketing officer and then the chief of external affairs. Collective was acquired in December by Point Click Care, which is the leading senior care technology platform in the U.S. 70% market share, I believe.
Yeah,
and then after that,
I can check. They can check out the interview of that. We did it with the CEOs. No, it was awesome.
Right on. Chris and Dave. Right. Right. That was cool. So great experience. Yeah. And I'm fortunate that they, when I returned to Innsena, they came with me as a client. So back at Innsena, focusing more on public affairs, government affairs work, as opposed to just straight communications. And, in any transition period, you're questioning what good you're going to do, right? What are you going to do next? And Janae was unfortunate enough to be the person who I called to have this conversation with, and she, of course it's Janae, right, who runs the Sharp Index. So she's like, Kat, you know what you could do? How could you impact physician burnout, right? And this hit me at the right time, and my passion has always been, how do we help women in the workforce? And one of my big platforms, I guess, is that I felt like having high quality childcare in my career made a serious impact on how much I was able to achieve and how I got to where I am, honestly. And so we were talking about that, and she said, hey, I have an idea, and that's how Mothers in Medicine got started. So what the fund is, just, real general baseline here is that it's a collaboration with Janae's nonprofit. It's a fund under the Sharp Index, and it provides flat grants to clinician moms to help them pay for their childcare so they can continue on their careers without having that burden of worry about, is my child getting high quality care? So that's what it is, and it's only been around since March, and really excited that people have been willing to donate to the cause, and really excited that you're willing to interview us about it.
No, definitely. I mean, obviously, burnout's an important topic, clinician or otherwise, right? And I mean, COVID definitely brought that into the spotlight as well. But I think it is interesting that you're approaching it from a childcare and how important that was to you. What has been your experience with kind of mothers in the workplace? I mean, agencies are full of mothers. I know your agency in Innsena, right? Like, we have one.
I think we have two. We have two now. Two men work with us.
Yeah. So you're full of it. But what's really been your experience in the challenges that they face that are unique?
Yeah. So, and just, in general, right, women in the workplace in general, and then we can talk about clinicians, but I was pretty fortunate, right? Like you're saying, agencies are dominated by women, right? Dodge, now Merge, was 90% women when I worked there. And when I had my boys, Innsena, as you mentioned, is lots of women work there. But it's different in the corporate environment, right? My experience at Collective Medical was not like that, right? It was, we did have a pretty good leadership team with women in the C-suite, but it's different, right? All of a sudden, I was working with more than two men, right? So a little bit reverse. But I'll say, even in an environment like Dodge or Innsena, you're still, when you have children, most often women are earlier in their careers, right? It's, you're in your 30s, maybe a little younger, maybe a little older, but that's really when your career is taking off. And it might also be when your take-home pay is equal to childcare costs, right? And I think that's people talk about the mommy tax, and the mommy tax can mean a lot of different things to a lot of different people. But how I always saw it was, you might be paying just as much as you're making, or you might be paying a little less, or sometimes a little bit more. Do you pay that and continue progressing in your career with the hope and the promise that you are going to get beyond that, and you're going to be promoted, and you are going to be able to make more money and climb the ladder? Or do you say, this isn't worth it, right? I am working my butt off. I am in an environment where I have to work a lot of overtime. And what am I doing this for? And I think a lot of women face that. And beyond that, a lot of times they aren't even able to afford really good, high quality childcare. So they're paying so much for something where they don't really feel good about it. And they're worried. And they're worried that, their babies are with someone who doesn't care about them. Or there's a lot of talk about one of the benefits of consistent childcare, right, is you have that consistent caregiver. There's not a lot of turnover. There's someone who knows your child and who can just, provide that space for them. And so I had that. I was very lucky. I found a really high quality childcare center. Shout out to Water Oak Academy. Woo-woo. But it was an in-home daycare, right? So I knew the person who was taking care of my children, and I think that relationship was helpful. Those are often more expensive, right, than a big box daycare. Sure. or whatever else. Sometimes you can't afford daycare at all. So I think that for me, knowing that I had that and seeing some of my colleagues, when you're an agency, you work all the time, whether you're working in the office or you're working at home, it's pretty constant, and that's just the way it is. So even though you're in a female dominated industry, the pressure's still there, right? Yeah. And it made a huge difference, and it made a huge difference, I think, as compared to those who weren't able to find someone like that or afford that. So I think
it's interesting how you talk about it, even, right? Like, I mean, just hearing you, like you're giving them a shout out because you have such affection for them and appreciation for what they did and provided for you. I think that illustrates the point really well, I think.
Oh yeah. I mean, wonderful experience, really. And when you have your first child, you don't know how you're going to be, right? You don't know if you are going to want to go back to work, and you might be, sure, a total killer, and you're going to say, I'm going to go back to work after 6 weeks or whatever it might be. And then you might completely change your mind. And right. You see that baby and your world changes, and it absolutely does. But I remember, that I took 3 months off. And I remember with my first child really questioning, what am I going to do? Because the paycheck difference as opposed to childcare costs was not meaningful. Sure. And I remember reading a lot of research, like, am I a terrible mother if I put my baby in childcare and want to pursue my career? Right. And one of the, obviously I had a bias, right? I wanted to go back. So I was looking for information that would confirm that bias. So I could text my mom or something and say, this is actually fine. Look at this research, big deal. But one of the things I read that it helped, it kind of freed me, right? And helped me make that decision was, there is no difference in IQ, adverse child events, or I'm saying that acronym wrong, but like there's no difference in outcomes for children who stayed at home with their mother or father, and children who had a consistent caregiver early. There is a difference, and this was even with my confirmation bias, pretty noticeable. There is a difference with children who did not have consistent childcare. Their outcomes are different, and in some cases not that good. So, again, that's back to my point that if we can make that a thing in the U.S., then I think that's meaningful, and that's worth fighting for, and that's worth donating for, and spending a lot of time on.
Yeah, I think about my first boss in healthcare. She was the director of the health center. And I remember having this conversation with her about, and I think I was just having maybe my second kid or something. We were having the
Mhm.
conversation. And she's like, "Oh, I knew I wasn't going to be home. That wouldn't have been good for my kids," which was, it was interesting. She was self aware enough to know that she's like, I needed to get out and I needed this as part of who I am. And that makes me a better mother, which I thought was interesting. That she had that self-awareness and that that
Mhm.
understanding, because it is a challenging decision. Now you've already
It is.
given a number of these I don't know if you call them grants or to these people. How does that, having those dollars, really impact them? Have you heard any stories, or what have you seen from
Yeah.
helping these people out?
Yeah, it's really cool. We've had a lot of nice outreach from moms saying they want to share their story, and we're a little bit of a skeleton operation here. So I think
Yeah.
we've done a few interviews with some of the moms and are going to be publishing more soon. But I think that so how we structured it is, the application. We're not like reading essays or anything like that, right? We're not like hyper qualifying people. What I really wanted to do is. It's just help people, right? And I think there's a lot of nonprofits that do big advocacy work, and because I think fundamentally we do need a policy change to really make an impact on this topic, childcare in general for professional women, not just clinicians. Um, but that takes a long time, and it's meaningful work, and it's hard work, and years long slog through a lot of crap. But I wanted to be able to help people right now. I know what a difference having that money on hand can make, and how it can, especially for women. Like, we haven't gotten to clinicians, and I'm rambling, but you see those stories come through during COVID where mothers were getting apartments so they wouldn't bring COVID back to their families,
Yeah.
right? Not seeing their kids for months. In some cases, you see some news stories a year, right?
Right.
And like, what a difference can it make for someone like that who can't go get an apartment, right? But who doesn't have consistent care. I think there's a stat that we have on our site. 25% of clinician moms don't have consistent childcare for little ones at home. So, um, I think I saw a lot of that, and this is my industry, right? This is really the only world I've ever known. And you think, how can I help? And I can help by helping these moms pay for a month of childcare, right? And I think that's meaningful. We wanted it to be enough that it wasn't going to be like $50, right? You can you can
Yeah.
buy a few
Doesn't
groceries
really
on
change
that.
much. Yeah.
Right. Childcare is expensive. Like, our average that Janae and I and some of her team research, it's about $1,000 a month, depending on where you are in the country per kid. That's a lot.
It is.
So we give out flat grants, $1,000 each. We don't ask a lot of questions, right? Which I know might scare some people, and think that people are going to take advantage of the fund. But we do make sure you're a clinician. We make sure you have kids, right? And then we trust that if we give you this money, it's going to help you catch up or take a break, and do what you need to do, right? A lot of mothers in general, and especially clinicians, did not get a lot of support from the government during the pandemic. And I'm a big fan of action, and this is what I'm trying to do, right? Make a real impact.
No,
But
that's
you asked about what we've heard from moms, and so it's a lot of what I hoped, right? It's hey, like, this was huge. My husband lost his job. He had his own business. He had to shut it down. He couldn't get a PPP loan, or he got a small one, because of the rules of having employees versus contractors. And I was still having to work every day, and I had my older children at home. It's all the stories we've heard. And it's been meaningful for them, right? We interviewed our anesthesiology resident from Mount Sinai, and she said, "Hey, like, I'm going to be, $500,000 in debt." And I have two children, and I live in New York City, and this was a big deal. So it feels good. And it's a newer fund. I think we've given out about 20 grants so far. And we have a queue of, I think, about 15 more. And so I'm excited to follow up with these moms and just see, hey, what did it really do? Where was it meaningful for you? And so far we're getting good feedback.
It almost feels like it's not even maybe as much about the money in some cases, but almost the admission, or like the acknowledgement that hey, this is a problem and this is challenging and we see you, right? I mean, I don't
Right.
know. It feels like the way you described it, right? You know, what's $1,000 when you got a $500,000 loan, right?
Right.
But
Exactly.
it's
Right.
like, hey, but this is the burden that I have, and someone understands my burden and is trying to do something to help. I think that's really amazing. And that's probably really changed with COVID, right? And I mean, even the shift to virtual work, I think that's been good for some, but I think that's been really challenging. I know I've worked virtually for 10 years, 11 years, but it was much more different because now my kids were home.
Right. Right. Right.
That
Well,
impacted as well.
exactly. Exactly. So I think that same with me. I've worked at home forever and ever, but all of a sudden my boys are home with me, right? And it is really difficult to manage their virtual learning, and that really sucked. And it was hard for me. I mean, I've talked about that pretty openly. That there's times when I just like sat on the floor and cried because I missed an email about my kid's science project that I didn't even know about, right? And this is while we're all working like crazy and adjusting. And then you think, no one dies if I don't walk up to my office and send out a press release,
Yeah,
right? But someone might die if that nurse doesn't find someone to watch her kids and get into work. Like
yeah,
that is
that's true.
crazy. I can't imagine the stress. And I yeah, I think in a lot of ways there's a silver lining for a lot of people to the pandemic, that yeah, we may have more flexibility now. But it hasn't really changed for healthcare workers. It was just bad.
That's true. That's a good point. Yeah. So how do you think that childcare costs really do impact healthcare? You know, does it impact patient care? Does it trickle down all the way there? I mean, you kind of gave an example there, I guess. Or, I also think about it from maybe the shortage of nurses and doctors in healthcare. I wonder how many doctors and nurses we've lost because they had to stay home and I describe it as take virtual third grade with their kid, which is a
Right.
sad. Anyway,
Listen, John, like that math, like I don't even know how to do it. Like I had to do YouTubes, and like mostly I shouldn't say I did. I just kind of cried and my husband took care of it. But which is also a great position to be in, right? I have another caregiver in my life, and
right.
some of the
Yeah.
moms we've spoken with, they're single moms, right? They're single moms. Their kids are at home. They have to go to work. So to your question, like we were joking about a little earlier, I'm a PR person, so like I can spin this pretty hard. But I do think there is a patient impact. And, when we're talking about burnout, the physician shortage, clinician shortage in general, there's a lot of research in other professional fields, right? That women, top of their field, like but 35, just crushing it. And I think law is a great example of this. And I know there's some parallels with medicine. They'll be crushing it, and all of a sudden they have a kid, and you're in these high pressure environments where you are expected to work, till 4 a.m. And you just decide this isn't worth it, right? The world is not designed for working moms. And I think I've said that a lot. But I think it's especially true where there is less flexibility, like in a clinical field where you have to be there. So I do think that programs and the Mom Fund hopefully is a great example of this. But even like I was talking about that long-term policy change, that advocacy work, I think that if we can start designing programs around mothers in the workforce to keep them in those fields, I think we will see better patient outcomes because we'll have more clinicians. We won't have shortage issues, or at least as many. And I think also just the peace of mind you give a nurse has to go in and work a night shift, and she knows that she was able to afford someone to be with her baby throughout the night. I think that there's a peace of mind aspect that comes that helps you focus more, so
Yeah.
you're not worried. Your child is being cared for consistently and with kindness.
Yep. That's awesome. Well, what a great story. What a great effort. Appreciate all that you're doing and, together with Janae and the Sharp Index. If people want to learn more about mothers in medicine, where can they go? And, I assume you accept donations, and there's
We sure do.
others that want to be added to your list too, but where can they learn more?
Mm-hmm. Yep. So they can go to mothersinmedicine.org. There are links all over to donate, and there are links all over to apply. I would encourage any clinician mom to apply. It's a very easy application process. Again, we're not asking you to write an essay about why you need this. And listen, we make it really easy to donate too, like just a plug there.
Well, it's
You
a
know,
good thing to donate to it because, I mean, it has immediate impact. I think that's one of the beauties of it too, right? I mean, you get the donations, you give them away your a low cost infrastructure, which is valuable for me and the things I donate
yep.
to. I don't want, to give you $100 and then, 40 of it is going to overhead for your office. And you're like, no.
Right. Right. And I know you'll have Janae on later to talk about the nonprofit in general, but all of the money. I mean, I think PayPal charges us some money, right, for the transaction costs. But this is all just going to moms. And I know whenever we do a match event or something, Janae's like, I'm so excited to send out some money. So yeah, it goes straight out to the moms. And like I said, I mean, I think the advocacy work is critical, right? Super important. And there are groups that do that. But right now, that's not a part of what we're about. We're really just about direct impact. How do we help people right now?
Yeah, it almost feels like those commercials where you donate to the poor people in Africa or somewhere, and then you get the kid back. You guys should maybe start that. Like, here's the mother. Maybe they directly did it. It feels like
Adopt a mom.
yeah, I mean, it's kind of like that, but I mean, but in this case, it's not quite that. That's probably the wrong tone. But like it could almost be a peer mentoring type thing. Anyway, yeah, it's nice that you have that direct impact, though. Well, thanks so much, Kat. This is really awesome. I think it's amazing that you're helping these women and helping them understand that they're seen and that you understand the challenges they face and doing what you can to help. So everyone, if you're watching, be sure to go check out mothersinmedicine.org and you can donate and support this great cause. And if you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com. Thanks, Kat.